All right, here we are. This is Jay Brown Yoga Talks podcast. My name is Jay Brown. If this is your first time listening to the show, let me welcome you. Everyone else, what's up? How is everyone feeling? Maybe we could take a moment to check. If you're like running around and doing stuff, if you're driving your car, of course, pay attention to the road. But maybe we could take a moment, just see, can we have a sense of how we're feeling in this moment? How are we feeling physically? What's the pain level like? How are we feeling mentally? What's the anxiety level like in your thought spirals today? Hopefully, you're doing okay. I surely hope so. If you were here last week, you know I was sharing that I had a pretty nasty pain flare-up. And sitting here now, having just done my own check-in, I would say that my pain level is considerably less now than it was last week. And I'm very grateful for that. I feel like I made good choices in terms of what I did physically with myself. Mostly was doing less. But also, I was really reflecting on how much of my personal practice or my personal process of trying to address my pain had much more to do with managing my internal experience, like my mental frame or my mental health, you could say. And I was also thinking a lot about last week's episode with Ryan Kurzak. He made a statement about yoga is not healing. And I've just been thinking about that so much. I think I know what he meant. That if you're looking at, say, the Yoga Sutras of Patanjali, it's much more talking about an exercise of one's mind, of one's consciousness, sustained attention, clearer perception, maybe absorptive meditative experiences of universal consciousness or other beyondness. You know, we talk about it all the time here on the show. And that doesn't mean that you're not going to have any physical pain. I think I've had this idea in my mind over the years that by cultivating facility with my own awareness and my ability to assert discipline, I would cure myself of certain pains. And you see, this pain flare-up I had is this particular pain that I suffered from 10 years ago. And I had it for a long time 10 years ago. It went on, I'd say maybe a year and a half almost. I had this pain. It was neck pain and a sort of thoracic outlet syndrome kind of thing into my shoulder and down my arm. And I just suffered with it for quite a while because I was just doing all these things that I thought would help it that were definitely not helping. I had all these ideas I was imposing on my body to intervene to try to fix it rather than sort of nurturing it like one might say a plant, you know. And I felt like I learned something very important. I learned something about my own patterns, and I thought I understood why I had that pain come into my life, and I felt like the changes I made would have cured me of that pain. I wouldn't have ever thought that that pain would come back, given that I didn't do any of the things and I didn't have the same situation or conditions that I thought had created it before. However, like I said last week, if I really feel deeply into the moment, there does seem to be something that connects the moment I'm in now to when I last had the pain. And I do feel better equipped now. I do feel like my yoga has done something to help me with a healing process, in that I have more clarity about what's happening, and the way that I'm relating to the situation, the way that I'm relating to the pain is drastically different now than it was 10 years ago. And that's certainly helping. But the way that pain is coming in and moving through me is just throwing me for a little bit of a loop, because some of the ideas I've had about what I thought yoga practice was doing in terms of healing yourself, both physically and mentally, doesn't totally pan out. And you know what it makes me think of? It makes me think of the recent revelations about SSRIs in treating mental health conditions. Most of you have probably heard of this. I've talked about it on the show before, that there was research that came out where they tried to prove that the premise behind SSRIs, that serotonin in your brain correlates with depression. So if you regulate the uptake of serotonin, you can treat depression as though it's a chemical imbalance in the brain. Well, that was disproven. Basically, what this research showed was that you can show clinically that people report that it has helped them, but we don't know why. We don't know what the mechanism is that's making this pill help them. And I've started to wonder if that's also true in a way for yoga. Like, do we really know what the mechanism is? Or is that what the sutras are, trying to explain what the mechanism is? But that mechanism that's explained in the sutras, is that connected to or the same as the mechanisms that work in our body that allow pain to come in or come out? Or is the pain just forms of consciousness? So I'm saying, I've been doing yoga for 30 years and I know it helps me, but I continue to inquire into how, like, what is it about it that helps? And what are some practices that help some people but not others? And, you know, everybody needs what I need. All these questions, you know, that's a lot of what this show's about, is me sorting through it all. And it's very much the topic of today's talk with Dr. Lauren Tober. Lauren has something that she started called Mental Health Aware Yoga. It's an upcoming book and also training that she does, I believe. And she's bringing her experience and learning in clinical psychology to yoga. She has a foot in both worlds. And I won't say too much more because I talk about it with her, that I just felt like I have been recently interfacing with the world of clinical psychology with my daughter, and I was doing so through my yogic perspective, and I don't know, all these questions came up for me. So it was a great pleasure to have this opportunity to ask them of Lauren. I really appreciated getting to meet her, and I'm very happy to be sharing it with you today. Real quick before we get to that, let me mention that if you're enjoying what you're getting from this show and you want to connect with me in other ways, there's lots of opportunities for us to do that. I have ongoing live classes. I've got a weekly discussion group. I just released a brand new on-demand video course called the Yoga Modules that I'm very proud of and excited about. There's also other stuff too. If you want to connect with me, the best way to do it is go to jbrownyoga.com. Okay, I think that's fine. I will touch base with you on the other side, but let's go ahead and get to it. Let's listen to this conversation that I had with Dr. Lauren Tober. Hello.
Hey, Jay.
Hi.
Nice to meet you.
Nice to meet you, Lauren. Forgive me, right before we started, this light came shining in. I've got this crazy sunbeam coming in.
It looks just beautiful.
Well, pleasure to meet you. I don't know if you've listened to the show. I guess you listened to that one episode, but I don't know if you listened to other ones. I'm already recording, and if it's okay, I want us to consider ourselves having just begun.
Hi. That light looks magic, Jay.
I hit the camera to come on, and then I looked, oh my God, this is the way that it's timed out.
When I was a kid, when I saw light coming like that, and especially when it had dust in it, I always used to think it was God. I didn't grow up in a religious family, but I just had this feeling of like, God, I don't know. I don't know why.
We'll come back to that, okay? We'll come back to the rays of God coming through the window. No, it's lovely to meet you, and I'm glad to get this chance to speak with you. There was a lovely synchronicity that brought us together. And,
yeah, Nicola reached out to you.
Yes, and I mean, I don't know what her motivations were, and sometimes it takes a little while between like when someone makes the suggestion and like when I have a moment and I look at the website or whatever and I go through whatever process I go through and be like, oh yeah, let me send an invitation here. And with you, I was just in a moment, I was reflecting back on what had happened with my daughter, and I sent you the episode. And it really felt like, to me, it was me interfacing with allopathic medicine, conventional medicine of mental health treatments, and my like yoga learning and yoga sensibilities. And, I was involved in some early yoga therapy meetings back when the IYT was doing its standards. And it was just so interesting to me. There was like this thing that I saw on your website. It said, soul without being new agey and evidence-based without being clinical. And I was like, whoa, because especially that word clinical.
Yeah.
Because when I was in the yoga therapy talks meetings and when I've heard that word used at other times, often it seems to mean like that there's now these like set protocols that need to be followed, and that like there's a diagnosis and then there's established ways to go about it, given that there's like a number for it and everything. And that's very much what I was like interfacing with again. And there was a value there. I've had a knee-jerk reaction in the past where I want to say, oh, it's all horrible because it doesn't have interconnectedness or the rays of God coming in the window. But at the same time, I did recognize a value there.
Yeah.
So the fact that you seem to be looking to kind of bring together some things intrigued me, and that's why we're here. Yeah. So thank you so much for making this time on the other side of the world to speak with me today. I really appreciate it.
Well, it was beautiful from my end as well. And first, I'm just going to apologize. I have my puppy here in the room, and my kids just left for school, so he's a bit kind of sad that they left him here with me. And he's kind of snuffling in the background. So if you hear some snuffling and chewing, it's not me, dear listeners. It's my
no
my
worries.
Puppy.
Dogs are allowed on this podcast for sure.
Amazing. But I'm hearing what you're saying about the clinical and the non-clinical and the value of both. And, I was trained as a clinical psychologist, which meant it was, very learning all about the DSM-4 at the time, the Diagnostic and Statistic Manual, and the different diagnostic criteria and the treatments. And the psychologist, you're the professional, like the expert, and you're kind of bestowing your professional knowledge on your clients who come to see you. And after I graduated, I really kind of moved away from that and really saw myself as a non-clinical clinical psychologist. Like I still had the title, but I, moved away from that. But now, I've been doing it for 20 years now. I'm coming more to see more and more the value of diagnosis. So I've kind of come a full journey. And I think part of that is, if I can just go straight into it, is that there's so much less stigma around mental health than there was, I feel, 20 years ago. So it's not such a weight to carry a diagnosis. I also just think like it can be incredibly helpful. Like for some people, definitely, will say, don't give me a diagnosis. I don't want to be put in a box. I don't want to be trapped in this diagnosis forever. And I think there's definite validity in that. And for other people, it's like, now this makes sense. Now I know what's going on. This explains what's going on. And it sounded a little bit like that when you interviewed your daughter in that beautiful, touching interview with her, that diagnosis was really helpful for your family.
It was, but what I would also say is that I could also see like the limitations. There were some pretty big limitations, where I think that the reason that my daughter is doing better, and I can't say this definitively, but just is that my wife and I were able to adopt a more like biopsychosocial spiritual model than the doctors alone were able to. And they were very helpful and respectful, and maybe even seemed to recognize that some of our choices were coming out of that. But, our choice to see if she could not take the medication and do a few things that, like in the parents group for kids with OCD, nobody was saying that to any other parents, and you could kind of see what seemed to me like, I'm a nerd, so I went and read the research, like I wanted to know where the protocols were coming from that said giving the kids whatever 200 milligrams of Zoloft was the right thing to do. And when you go and look at, and I must admit, at the same time, it was only like not that long after, like a month or two after that big study came out about SSRIs and how they couldn't show the mechanism. Like they can show that people have been helped, but the whole idea that it was about serotonin in your brain couldn't really be proven. So I already had that in my brain when we were deciding to have her take them. So for me, it was really like, I didn't know what to do. I didn't trust I'm not a professional. They talk about, like people having expertise or knowledge in things that you don't have, and yoga teachers don't know fucking everything, So to me, I was like, I need help. I need the help of a professional who knows what they're doing. But I was also like, whatever yogic discernment I've developed over the years, wanting to parse what we were doing. And so, it seemed to me there were side effects from the medication. And then there was another medication that they were prescribing to deal with the side effect of the medication. And there was a diagnosis, all the kids are ADHD, when the study showed that one of the side effects of the Zoloft is activation and they get all hyper. So in any case, I bring it up only because there did seem to be a limitation. And I suppose my question to you, when people talk about yoga for mental health, like sometimes that can mean, yoga as exercise, because people, like there's a study came out 2 days ago, something that showed exercise worked better than SSRIs for depression. So just moving and being in your body and going for a run or doing a power flow yoga class can have just a kind of baseline help to someone's mental health.
Absolutely. Yeah.
But then there's a lot of like yoga for trauma and people really looking to utilize yoga to address other mental health issues. And so I guess from the work that you're doing, how much of it is like physiological stuff and how much of it is other psychosocial aspects, or is it all of it?
I think it's all of it. And I'm not sure you can break it down so easily. And I think that's one of the beautiful things of yoga in many ways. Like it's so broad and it kind of defies categorization in so many ways. And I think that's why it can sometimes be really difficult to research the effects of yoga on mental health, because there's so many different ways of practicing yoga and there's so many different components. And in the scientific research, they like to break things down either into manualized protocols. So it's like a 6-week program, like mindfulness-based cognitive therapy or something like that, or take the individual pieces. So, what effect does Brahmari pranayama, for example, have? Or what effect does, XYZ have on the system? So the scientific method can't really encompass the entirety of yoga. So I think we can look to the research. My puppy's sad about that. We can look to the research to gain some really valuable insight. But I think what's more important is looking at our own experience and how it affects our own individual needs and individual constitution. And if you look at the research, they always use the letter N to denote the number of people in the study. And usually it's, like 100 and something, or if it's a big study, it'll be 1,000 people. But what I think is equally, if not more important, is to do an N=1 study and try things out on yourself. So you have a population sample size of 1, and that's you. And you try the practices out, or you try the medication out, or you try the different therapeutic models out on yourself. and you see which works, and you keep doing that. And you also use, like you talked about, Jay, this discernment. And I think this is what we all need to use when we're navigating, life in general, but particularly health or mental health challenges, is discernment. We need to put ourselves at the center of our own healthcare. And then we need to bring in the people who we feel are going to help us. And instead of handing our power over to them, we bring them in as consultants, or we bring them in to support us on these journeys that we're taking.
I hear you. I guess my question comes out of there's so many claims that yoga makes about what it's going to do for someone. And I had someone on the show this week, as a matter of fact, who kind of made this statement like, yoga is not healing, which I know was like, what? Because everybody thinks of yoga as being healing, but he comes from a Kriya yoga tradition where they're thinking of yoga in certain ways. And even he was making kind of a point. It was more of a reaction to like yoga for back pain or yoga for this. And this idea, if I just go to this power yoga class and plow through it, it's gonna make me strong and flexible and heal my injuries and cure my depression. I guess I'm trying to look at, like, in the same way that we don't understand what the mechanism for SSRIs is to help people with their depression, do we understand what the mechanism is for yoga to help them with their mental health?
Yeah, thank you for bringing me back to the question. Yeah, so I feel like you said, it can be exercise. If it's a movement-based yoga, that can be incredibly helpful with mental health. I think community or connection with the teacher is an important part of it as well. So coming together as a group, and that relational part of it. So whether it's in a group or it's one-on-one, that relational part of it, and the moving together can be incredibly helpful. You know how when we chant kirtan or we go to a yoga class, when we move together, that can help us to feel more in sync with other people. So when we're feeling depressed or we're feeling anxious or we've experienced trauma, we often feel disconnected from our communities or disconnected from ourselves. And so moving in our own internal rhythms and then moving with the rhythms of the class or with your teacher can be really, really healing as well. And then, the breath practices, all the practices really that yoga gives us to regulate the nervous system can be incredibly helpful. So whether that's pranayama or asana or meditation, yoga just has this vast array of practices that I think really help us to regulate the nervous system, which is a big piece. And then also, like you talked about, like cultivating discernment, like getting to know ourselves. That means that we can make choices. We get in tune with who we are and what we need, and then we can make choices in the world that are supportive of that. So many of us are in our heads. We spend so much time thinking, and this is also true, often can be true when you're going through mental health stuff. There can be a lot of rumination, so we can get stuck in our heads. And so yoga can really help us to get back into our bodies. I mean, we can also do yoga and ruminate the whole way through it as well. So there needs to be this intentionality of coming back in the body and practicing in a way that supports that kind of interoception and sensing the body.
And I guess what I hear in what you were just saying is you're definitely in a yoga frame more than a clinical psychology frame, in a sense. Like, it sometimes seems to me, I remember thinking about this back when my wife was giving birth, and we had these doulas that we were working with, and they were trying to work within the hospital setting. And for a while they were able to do it because they had a relationship to this one hospital, but eventually they stopped working through the hospital because there's a point where the way that they were working wasn't compatible with like the rules of the hospital.
Yeah.
So do we have to step outside of Western clinical psychology in order to have yoga be yoga? Or is there, like, I'm looking at where's the intersection or where's the overlap between the clinical psychology and the yoga? I know people will have clinical psychological analysis of the sutras and stuff sometimes, but more specifically in terms of dealing with mental health, like, where do you see them being compatible, or where do you see them not being compatible? Or
I think they're incredibly compatible, and they can be two separate things. So you can go to a yoga class and you can go and see a psychologist. And there's yoga teachers and there's yoga teachers, and there's psychologists and there's psychologists, right? So you said that your treatment team, when you were seeking support for your daughter, were quite like supportive and understanding of your choices. That's what you want to find, right?
It wasn't easy though. Let's just say
it's
that.
Not easy.
You got to work hard to find that. We got lucky. I think it was grace.
Yeah. Yeah. And sometimes you have to go and see a few people before you find the right person as well. So I think you need to be willing to go and interview people, instead of just saying, well, you're the expert, fix me. It's like, no, I'm going to go in and I'm going to actually interview this therapist and see if they're a right fit for me. And actually, when I work as a clinical psychologist, when I see clients, I always say to them in the very first session, let's have this first session and I'll get to know you and you'll get to know me, and I'll see if I think that I can help you, and you'll get a really good sense in the first session if you think that this is going to work. And at the end of the session, let's have a discussion about this. And if it doesn't feel like a good fit, just tell me and we'll talk, I'll recommend someone else, or we'll find another fit. And I remember when I was studying and I said to my professor, like, what's the best type of treatment for different presentations, right? Because there's so many different, there's cognitive behavior therapy and interpersonal psychotherapy, there's so many different treatment modalities. And he said, and I still remember this to the day, it doesn't matter. There's no right treatment methodology. I mean, that's not true. There are for some presentations, but generally it's the relationship between the therapist and the client that makes the most difference, more than the therapeutic modality that you choose to use. So it's that relational aspect that is so vital.
I mean, I think that I found that to be true in terms of yoga as well. And within yoga, there's different traditions where it's more or less about an interpersonal exchange. I'm very inspired by TKB Desikachara. It was very much an interpersonal one-to-one sharing that was going on. He said yoga is relationship. That was his statement. And again, it's just interesting to me that there isn't necessarily like random controlled trials to prove that the relation, or maybe there is, like relationship is the key so much as other factors that go into the treatment protocols. So that particular teacher of yours really did you a service, I imagine, right?
Yeah. I mean, this was 20 years ago, right? So I don't have the paper off the top of my head, but this is what he said to me. The research shows it's the relation that you have with the therapist more, over the type of treatment protocol that you use.
Interesting. And I guess when we talk about relationship, whether it's teacher-student relationship or therapist-client relationship, there's all kinds of dynamics that come into play. And I was looking at your bio and I was seeing that you studied Ashtanga yoga with BNS Iyengar. I took note of, because we had someone come on and talk about BNS, and not everybody knows about BNS. They always go, I think you mean BKS. And I say, no, I mean BNS.
That was an amazing experience. I'd love to go back and hear that interview.
Oh, yeah. I was talking with a couple of different people, one person in particular, a student of his, about some of the distinctions. So I guess I'm curious about your, first of all, which came first in your life? Were you yoga first and then studying clinical psychology, or were you into clinical psychology and then started doing yoga?
They came at the same time. I was doing my undergrad and I went on exchange to UBC, University of British Columbia in Vancouver, just when I was finishing up my undergrad. And that's where I got into yoga. I went to a class in a community center and I just loved it. And so, yeah, they began together. And at the time I didn't know anyone that was integrating yoga and psychology. So this was 20 years ago, I guess, over 20 years ago. And it was, I didn't know anyone that was doing it. But I just felt this, okay, there's something here. So they really developed together.
And I guess I'm trying to imagine you being in India, and I heard you on Shara Carruthers' podcast. Shout out to Shara. We have a mutual friend in her, and she's a lovely person. So let's shout her out if she hears this. She might listen to it. And I heard you talking to her about some of your experiences going to India and kind of like people talk about transmission. And that's sometimes a little bit of like a taboo thing because, there's been all kinds of abuses and we know all the things that have happened. So I guess I'm curious, the contrast of that, of the learning pedagogy or environment of going to a shala in India and studying psychology at university. That didn't feel like two different complete worlds, or like
completely different worlds. And so when you ask me the question, like the actual practice of psychology and yoga, to me there is so much overlap, right? But the way that you practice psychology and the way that you practice yoga can make it quite different. But I believe they can be very similar. But the study of psychology and yoga, the way that I studied it in India, was very, very different, worlds apart. And I appreciated both. Like I loved India. I haven't been back since I had kids, and I miss it. Like I'm feeling this calling to go back there. So that's definitely on the cards soon. But at the same time, it was very confusing. I spent 9 months there, 1 year, studying and practicing yoga, and I there was a full immersion in it, but I came back like very confused about what yoga is, and because there's so much information and it's presented in so many different ways, whereas in my psychology studying, it's like very clear. There's chapters and there's bullet points.
There's a right answer, huh?
Like one of the teachers that I studied with, Jay Kumar in Mysore, and he would start the session with the satsang with "Yes, please," and just sit there. And then he would wait for us to ask. And so this was a teacher training course. Instead of giving us the information, he would start with "Yes, please." And then we'd ask questions, and then, the discussion would start, but it wasn't directed. It was very, very different to studying in Australia or Canada.
See, that's a really good example on something I've been talking about on the show recently, because I've heard people talk about Desikachar the same way. I remember Eric Schiffman talking about how he wrote to Desikachar and said that he wanted to study with him. And he said, okay, because that's what you did back then before there was like internet stuff. You like wrote a letter, and then they wrote a letter back and said, yes, you can come. And so he went and stayed with them, and they would have these like one-to-one time to have these sessions. And for like a while, like Desikachar they just like hang out and have tea, and like they would never really talk about stuff or do stuff. And then like one day he asked a question, and Desikachar went on for hours, and he realized, oh my God, he's just waiting for me to ask things.
Yeah.
And then he started asking all these questions, and he got all this learning that he was looking for. But the idea that the teacher doesn't come in with a set of learning objectives or bullet points that they're going to deliver as a passing on of knowledge, as opposed to it coming from the student or the person more. That's a totally different dynamic.
It's totally different. And you know what? I tried teaching like that in Australia, and it did not work. It fell so flat, Jay.
Especially if you're teaching at the gym or like some drop-in vinyasa studio or something.
No, I was invited to teach on a yoga therapy training, the mental health part of it, and it was just a weekend. And I went, and I had some things prepared, but I wanted to like honor my teachers and teach in the way that I was taught. So I went, and I kind of came with this "yes, please" attitude. I had some, definitely had some structure, but like opened up. What do you want to know? Like, how can I be of service? And I think some people appreciated, but many people were confused about what was going on in the course. And when I read the feedback session afterwards, some of the feedback I got was really not that great.
She didn't do it. You didn't do anything. It's so interesting that you say that, because I think I was talking about this with Lisa Peterson, actually. Like a lot of people who've moved into somatics have found a language to help with what we're talking about, it seems, in terms of inviting people into exploratory spaces rather than this idea of just like knowledge downloads or whatever. But it is confronting in a way that almost like certain art requires a participatory element or something. Yeah. Like it's on people to have to do it. They don't just get to pay and get it or something,
Yeah. Yeah. So, I still, when I teach yoga teachers now, I still have an element of both. But I do, with this mental health aware yoga training, like I have the 6 pillars of mental health aware yoga. I think like in Australia and in many Western countries, we like to have a little bit of structure. We like to have a framework. Like it just helps our mind to feel at ease, to know that there's some kind of structure there. So now when I teach, I do provide that structure, but then we also open up for just questions and discussions and explorations. And for me, that's where the magic happens, when we sit there and somebody shares something that happened in their class, and then we dive into that, or there's an ethical thing that came up. And, we share as a group, and we explore that as a group, rather than me sitting there and telling people what to do or what the right answer is. For me, that magic happens in the exploration.
I couldn't agree more. That's where all the really great stuff happens, all the things that I didn't plan, I also know what you mean about structure. Like I need structure myself. So there's a way to set up structures that allow for all this improvisatory space, or allow for the teacher to not have planned it all out or have a lecture. Especially with the Zooming, I found that there was always a certain amount of like me delivering some ideas or some things that I have learned, some kind of lecture component, and then there was always a discussion component. And so I just filmed all the lecture stuff. It's like, okay, watch this. And then when we get together, it's like what we're doing right now, because that's where we don't have a plan and there isn't something in specific, but we've got some common things that maybe we've both been looking at or contemplating. But now we're going to engage with one another. And that's where it happens, like you said, in the space in between, like the relationship.
And that's exactly the way that I teach now as well. The lecture material, the factual stuff, people can watch in their own time and digest in their own time and pause it and, come back to it. And then, coming together and having these conversations. And that's the part that lights me up, actually, those conversations.
Yes, me too. And I suppose, it's interesting to hear you say about people having some resistance to it, or when you do open up spaces in this way, like when the focus of the gathering isn't to do asana, isn't a handstand workshop, the focus of the coming together, as you're saying, is specifically to kind of be in dialogue or engaging on something else, and engaging with what's like most important to us or what's affecting us most, like you said, ethical issues and things that come up. Because I've been doing this weekly teachers call for like 5 years now, and before and then throughout the pandemic, and just that group, that time to just come and have a conversation about stuff, it's been so important. So I suppose that's where things come out, like, and that's where, like, yoga teachers do maybe need to, at least for themselves, be prepared or have some kind of scopes of practice that they've had some thinking around, because you are inviting all kinds of things into a space. And there's some people who are able to manage that in a group better than others, So is some of what you're doing, because I see some of your stuff is like training for teachers, is that kind of what that's about? Like how to work with stuff that comes up in classes? I haven't had a chance to see your book, so maybe you could say something about that too. I don't know what you've been putting in the book from your work that you want to get out there.
Yeah, well, I mean, I started doing this training. I call it mental health aware yoga, and the book is by the same name, because I was teaching specialized classes, yoga for depression and yoga for anxiety, and the students were really enjoying them. I was really enjoying them. It was going really well. But I started thinking, why, like, what I'm teaching here isn't really any different than what would be taught in a regular kind of well-rounded class by a teacher who understood mental health. And while I do think there's definitely a place for specialized yoga classes, I do also think, like, my kind of dream is that all yoga teachers understand mental health. And so students can be discerning, choose the yoga classes and the yoga teachers that work for them, and go to a regular yoga class. I think that's much more accessible and affordable and a lot less stigma involved in it. And so what I'm trying to support yoga teachers to do is to understand mental health. There was a study in Australia It was a while ago now, maybe 20 years ago now. A guy did, I blanked on his name now. It'll come to me. Stephen Penman, and for his PhD research, he looked at the state of yoga in Australia, and what he found was that about 79.4, nearly 80% of people reported that they were practicing yoga for the mental health benefits. So we can safely say, and anecdotally, we know this to be true, right? The majority of people are coming to yoga for mental health reasons, to support with their mental health in some way. But yoga teachers aren't really trained on how to support yoga teachers, how to support their students. And so that's what I'm wanting to do with the book and with the training, is really put this knowledge in the hands of yoga teachers, because I think we could go so far to say that yoga teachers are at the front line of contemporary mental health care. Like, people are coming to yoga, they might come to yoga even before they go to their doctor, or they might go to their doctor and then also, or their psychologist.
Or their doctor told them to go to yoga.
More and more, that's true.
Yes.
Yeah. So I think there's definitely a time and a place for specialized yoga classes, but I also think general yoga classes can be wonderful support for people when we're struggling.
I really go ahead. Sorry, what were you going to say?
Oh, I was just going to reflect on the book. I've always wanted to write a book. I love books. You can't see, but I have like gazillion books. It's been a long dream of mine. And so I'd written like the first draft of this book, and then I was on Shannon Crow's podcast, which I believe you know Shannon as well. Shout out to Shannon. And Singing Dragon publisher got in touch with me after they heard the interview, and they said, would you be interested in publishing a book? And I said, well, yes, I've already written one.
Nice.
So it's very, very exciting.
The light came shining through the window there, didn't it? Yeah. So that's super exciting. I really, congratulations, first of all, on the book, because I've had designs to write one as well, and it has not happened. It's quite an undertaking. So
it is.
I know what it is to do it. I've worked up proposals and met literary agents, so I know what that's about. So no small thing. So kudos and congratulations on finally getting it together and getting that little bit of grace. That's a beautiful thing.
I like that.
And I really appreciated what you said, because about bringing it to all yoga classes more. Like, I mentioned earlier that I was part of these talks that happened at the International Association of Yoga Therapists in their early time when they were first developing their standards for yoga therapy trainings. Yeah. And I remember being in the room, and some people were really vying for like a very high standard. They wanted 1,500 hour, like college level, like standard to like really make yoga therapy a high bar. And then there was other people who were wanting something less. And the conversation in the room was, I remember I got up and spoke, and I was nervous because there's all these big wigs in the room, and I was like this young punky kid. And I was asking, is yoga therapy mean a clinical application? And it wasn't clear what that meant, because as we said, sometimes it means set protocols and numbers, and sometimes it just means you actually see patients. Like, some people think of it, the word can be translated in different ways. But I made an impassioned plea in that room, which was, all the things that we're talking about yoga therapy being, to me, is what I learned yoga is. And so if you make it yoga therapy, like, what's missing from all the fitness classes, which is why they want to distinguish themselves from Yoga Alliance or whatever, what's missing from those fitness classes are these principles of assessment and adaptation and like all these protocols of safety, essentially, and like sensitivity and all these things that for me were what yoga was. And I said, and if you take that and you make that yoga therapy where you have to spend a bunch of money and the person wears a white coat, you like relegate it to the hospitals and the universities. I want more yoga therapy in all yoga classes. And that's where I, like you, decide I don't want to work in a hospital. I don't want to be clinical. And in this thing that I wrote for the IYT, I called it Clinical Yoga Therapists and Preventative Care Yoga Therapists. I didn't know what else to call us, because we were employing all the same things, but we weren't doing it in those settings. And we were wanting to embrace like these more, biopsychosocial or process-oriented models. There was prescriptive and process-oriented. So I guess all that is to say that it's interesting to me how I know some other people I was speaking with about this, where some of us just through the course of our own practice of our own injuries and pain and embracing like gentler and slower, more mindful practices, if you will, because that's what we needed. We ended up inadvertently becoming trauma informed in certain ways. Like, because when that became a big discussion, and I was like, okay, well, what are the best practices for trauma-informed yoga? I was employing many of those things just because that was the kind of class I wanted to have. I said to myself, a lot of what I do as a teacher is dedicated to my mom, and I wanted to have a class that my mom could come to. That was that's what led it.
Nice, nice.
And so how specialized training does a yoga teacher need to have in order to have a class that can be supportive of people working through their own mental health?
Yeah, so I think I'm not trained as a yoga therapist, so I don't want to speak for yoga therapists, although I have taught on the mental health modules on yoga therapy trainings, and yoga therapists do come and take this training, and I think there's a lot.
If you are hearing this message, then you're listening to the free version of Jay Brown Yoga Talks. To hear the rest of our conversation, please subscribe to Podcast Premium at jbrownyoga.com/premium.